Hello, my name's Stuart Young. I'm a poultry veterinary surgeon based at Cullerton Barton in Broadhenbury, part of the Mount Veterinary Group in Wellington. We're here today to look at the anatomy and physiology of chickens and to do a basic dissection to help the producer. Before we start, we must discuss biosecurity. Biosecurity is a term that's used to protect your birds against disease, from bringing disease onto your site or spreading disease elsewhere. That is why we're dressed in the protective clothing. The most fundamental thing is to wear gloves. That is to protect yourself from some diseases that can be passed to us and cause mainly gastroenteritis signs. Diarrhea. The other thing is I've got protection for my hair, down the body, and protection against any discharges with regard to opening the birds. In terms of equipment to perform the dissection, it's very simple. Gloves I've already mentioned, and if the gloves rupture, then you must replace them straight away. A pair of scissors, sharp scissors that will be able to cut through the skin easily, through the muscle and through the bone. I also use a pair of forceps in a post-mortem situation to help handle the tissues. It's also important for people that have allergies to wear a suitable mask that will provide protection. We're now going to go on to the dissection of the bird. The bird that we're using is a bird that's come to the end of its productive life and was going to be euthanized. It is a brown laying bird, standard breed for the UK producer. First of all, I always look at the feathering of the bird and try and estimate the degree of feather cover. And in this bird, it's virtually 100%. The feathers there are to insulate and waterproof the bird and are therefore very, very important, especially during the winter period. If the bird loses its feather, it can make it very difficult for the flock to perform to its optimum. So lose the feather, lose the flock is a favourite phrase that we use. They have a very, very important function and they must remain. Feather pecking is a very serious condition, especially aggressive feather pecking, and it quite often starts towards the tail and the tail feathers because of a gland at the back which secretes oils to help waterproof the bird. So you may often see the first sign of feather pecking is these little white feathers starting to appear through the brown feathers, and that it can be a cause of concern. If we start from the head, the first thing we notice is the comb and the wattles. These should be erect, as in this bird, rather than folded. That shows that the bird is healthy. And also should have a very deep red colour, and that's because this area is very well perfused with blood. It acts almost like a radiator for the bird to lose heat. The other things to notice are the eye, and if you pull the eyelid down you will see a pink area called the conjunctiva, and we all probably know the term conjunctivitis, which just means inflammation of that skin around the eye, and it feels like you've got sand in your eye. Now the birds can also get conjunctivitis when exposed to various abnormal particles in the environment, particularly ammonia and dust, but also viruses which are trapped in this area and form part of the immune system to try and protect the bird. We also have the ear, protected by a tuft of feather, just behind the eye, each side. The nostril is very fine on the beak, and just like us, if we get a cold, you can get discharges from that nasal area. The beak is actually quite light in comparison to a mammalian jaw, and is very adapted to pick up particles very quickly from the ground and to swallow them quickly.